Hello students, part 4 of chapter 65 in process, in progress. Lymphedema, an abnormal accumulation of protein fluid in the subcutaneous tissue of the affected limb after a mastectomy, is a commonly overlooked topic in health teaching. Not in our school. Risk factors include injury or infection of the extremity, obesity, presence of extensive axillary disease, and radiation treatment. Teach patients, especially those who have had axillary lymph node removed, that measures to prevent lymphedema are lifelong, and include avoiding trauma to the arm on the side of the mastectomy. Teach your patient to immediately report symptoms of lymphedema, such as sensation of heaviness, aching, fatigue, numbness, tingling, and/or swelling in the affecting arm, as well as swelling in the upper chest. So here you go, you have the picture. So probably she got surgery in the right breast, remove lymph nodes of the right and in the right side, and you see how the arm is totally swollen. A referral to the lymphedema specialist may be necessary for the patient to be fitted for a compression sleeve and/or gloves, to be taught exercises and manual lymph drainage, especially the manual lymph drainage is very helpful, and to discuss ways to modify daily activities to avoid worsening of the problem. Here comes the "that's good to know." Teach the patient how to avoid infection and subsequent lymphedema of the affected arm after the mastectomy. Teach how to assess infection and to avoid lymphedema. Teach the importance of avoiding having blood pressure measurement taken on, having injections in, or having blood drawn from the arm of the side of the mastectomy. So no blood pressure, not injections, no blood drawn on the side of the mastectomy, especially if lymph node dissection has occurred. Instruct the patient to wear a mitt when using the oven, wear gloves when gardening, and treat cuts and scrapes appropriately, especially in that arm, right? If lymphedema occurs, early intervention provides the best chance to control. That's good to know. Infection, you have to assess for infection in that limb, right? Remember, the patient they just had the lymph nodes removed. So part of the immune system in that area is compromised. So a little infection is going to be a huge emergency. Okay? Psychosocial preparation, concerns about appearance after surgery are common and are often a threat to the patient's self-concept as a woman. Whatever I just said about the infection is part of your critical thinking. Is part of your critical thinking. That's why you need to prevent all types of danger and infection in that limb. Okay? After breast conserving surgery, scars vary according to the amount of breast tissue removed, of course. Much of the one's body image is a reflection of how others respond. Discuss sexual concerns before discharge. Most surgeons recommend avoiding sexual intercourse for 4 to 6 weeks. Patients may prefer to lay a pillow over the surgical site or to wear a bra, camisole, or t-shirt to prevent contact with the surgical site during intercourse. For young women, issues related to childbearing may be a concern. Chemotherapy and radiation are considered serious teratogenic birth defect causing agents. I'm going to repeat that. For your woman, issues related to childbearing may be a concern. Chemotherapy and radiation are considered serious teratogenic birth defect causing agents. Healthcare resources available to the patient after discharge include personal support and community programs. After discharge, the spouse or partner may need help in planning support for home responsibilities. This is not a treatment for the patient itself. Is the husband, the family, everybody in that particular patient's family and close members, close friends, the spouse, everybody is having breast cancer, and everybody needs to recover, and everybody needs to pay attention to the support and how they are going um, to organize themselves. How are they going to behave? How are they going to promote and give motivation? And how are they going to provide mental well-being to this patient that is in recovery? That's very important. That's why you need to assess the support the patient is having. The American Cancer Society is a comprehensive resource of information for support and support of the United States, provide evidence-based information and language a layperson can understand. Okay, yes, it's an excellent resource for information. I would like to say the American Cancer Society. They have a group of houses or hotels or locations that are called Hop Hop Lodge, right? Uh, so this, I get to know a patient that was an illegal immigrant having cancer, stomach cancer, but was able to be referred from by the hospital he was treated. It was the Elmhurst Hospital. So they sent an application to the Hop Lodge by the American Cancer Society, um, that is located close to the Madison Square Garden. It's a huge building. They have they provide you with food, psychologic advice, counseling. They can give you. I mean, they have everything. Even ambulance. They can provide you with metro cards. All you need in order to recover, but they need your ticket, or they need from the doctor, they need to know when the treatments are going to be given, in what dates, and also they need to know exactly, since the patient was an illegal status, when he was planning to go back to his country after the complete treatment. So he was there for 6 months. They also ask you to have caregiver to be living with the patient. They give you like a huge, it's not an apartment, it's not a room, it's kind of an apartment. It's a one bedroom with kitchenette, with everything. That is per patient. It's amazing. They have rooms for gaming, they have TV, conference room, massage rooms. You have tried to Google search on Hub Lodge by American Cancer Society, and it's free. You will figure out this information and you will see how many people is helped by this society. Okay, so I gave you this information. What else? And we're done with this chapter, right? I think I finished with a very nice piece of information. uh, we all know somebody who needs help, right? In this country, that is not having the financial situation, or maybe they are illegal, or maybe they can be helped. In our system, most hospitals are providing treatments to people that they don't have the financial situation. But the problem comes when they need to go home and they don't have where to go. So Hop Lodge is a good place to go. They have different locations, and they are gonna provide you with transportation from the hotel or the place to your clinical for ambulatory care, and then after the chemotherapy or whatever it is, to the hotel. And if there is an emergency, they will call the ambulance. It's a complete service. So I hope you can help people by providing this information. Thank you guys for attending this lecture. Remember, it's your interactive blueprint for quizzes and the exam. And we're done with chapter 65.